Hello, I'm Professor Sophie Park. I'm working in Grenoble in France, and I presented during a EHA meeting a phase 3 trial called the EPO-PRETAR trial, allowing to evaluate the early introduction of erythropoietin, EPO, in low-risk MDS patients versus delayed introduction of erythropoietin. Okay? This was a phase 3 trial with 2 arms, with the early arm where EPO was introduced early, and the delayed arm where EPO was introduced when hemoglobin level dropped less than 9 grams per deciliter near the transfusion threshold. We enrolled 84 patients, 43 in the early arm and 41 in the late arm, and we have shown that for the primary endpoint, early initiation of ESA, erythropoietin stimulating agent, did not delay the transfusion dependence. Nevertheless, it was a higher response rate in the early arm with 85% of response rate versus 55% in the delayed arm. This not translated in impact on overall survival, progression-free survival, and AML transformation. In terms of quality of life, there was no difference between both arms, but in the delayed arm, there was a slight increase of anxiety. And finally, we have shown that there is a biological score integrating serum EPO level and IPSS-M. So it is a score which evaluates molecular gene mutations. And integrating these 2 variables, we could discriminate patients who will benefit from early ESA initiation with a higher response rate and with a delayed transfusion dependence. So the take-home message is that early introduction of EPO in low-risk MDS patients with anemia is a benefit for response rate and for transfusion dependence in a subset of patients according to IPSS-M score and erythropoietin level.